Hello everybody, greetings from Mankind, Heart Care Foundation of India and IGCP Group of Publications. All our viewers who are present at Zoom as well as who are present offline in various social platforms. Today we have gathered to pay tribute to some of our colleagues who have sacrificed their life from Madhya Pradesh and Chhattisgarh in a different type of a prayer meeting. Normally, when we do a prayer meeting, we have a bhajan, people are restless. But all of us decided to convert this type of a prayer meeting to teach those doctors, to teach what we have learned from these doctors who have sacrificed their life, so that we can take those lessons to save others and to save the society, and also to compensate some of these fellows who have sacrificed their lives. And that's what we are doing from state to state. This is our 8th such session. Every time we discuss about how to safeguard yourself, update your knowledge, and prevent further deaths. Manish now will be talking about the Mankind. Regarding Heart Care Foundation of India and MedTalks division of IGCP, we are devoted to interacting with millions of people in the society to take care of that, remove the fear from the mind of the people. Our basic objective is to create and to make society fear-free from Corona. Let's listen to Dr. Manish Chaudhary from Mankind. After he talks, he will also introduce our chief guest, Dr. Satish Joshi, Dr. Sanjay Londhe, and then our panelists, Dr. Sadhna and Dr. Natwar Shah.
Good evening, everyone, and thank you for joining us on this Sunday evening. As you all know, we have gathered here to pay our tributes to the martyr doctors who have sacrificed their life in fight against COVID, and the doctors who are real heroes as they put their life into danger on daily basis to save the life of those whom they might not be knowing even. So these are signs of a real hero, and today we are paying tribute to those who have sacrificed their life in doing so. Giving a brief about Mankind Pharma. Mankind Pharma is a totally integrated Indian pharmaceutical company. Established in 1995 under the leadership of Mr. R.C. Juneja, we ranked number 1 in terms of overall prescription generated per year. We ranked number 1 in terms of number 4 in terms of total revenues generated in Indian pharma business. Our overall revenues per annum is around $1 billion. We have a strong presence in prescription drug, OTC, and veterinary medicine. Our philosophy in serving life over the years has been to provide quality medicine, as every patient has the right to have a quality medicine at affordable price, because in India, as we all know, that our patients might not be in a position to afford high price medicine, and to make it available at every nook and corner, because still today more than 50% of our population resides in a rural area, in remote areas. So providing quality medicine at affordable price and making it available to every nook and corner has been the philosophy of Mankind Pharma over the years. A few milestones that we have achieved over the years are 1995 was the year when Mankind Pharma was established. The foundation stone was laid on 1995, after which we launched our OTC and veterinary medicine division in 2007. 2008 was the year when we gained number one position in terms of overall prescription generated per annum. 53 of our brands enjoyed at least one and number five position in their respective therapeutic segments. 21 of our brands number one in respective therapeutic segments. 2011, we established a state-of-art research and development center in Manesar, which is just outside Delhi NCR. 2012, we have entered international market. 2013, we ventured into the CIS states, and we were again ranked number one in terms of overall number of prescription generated per annum. 2014 was the year when our flagship brand Menfos condom was increased in market share to 27% and is today one of the leading brands in the market. Launching our operations in US, we started in 2017. Our operations in US, 2019, we have acquired a manufacturing capability in United States of America, and our manufacturing plant in India was US FDA certified. So these are the few milestones that we have achieved over the years. In doing so, we have a strong presence in nearly most of the therapeutic areas such as anti-infective, cardiovascular disease, gastroenterology, anti-diabetic, nutraceutical, and many more. We have a strong presence over the number of range of products, innovative mode of deliveries, and releasing systems and new formulations that we have in our market today. Talking about our research and development capabilities, we have a state-of-art research and development facility in Manesar, just outside Delhi NCR, with more than 400 plus scientists working day and night. We have the capabilities of performing clinical trial from phase 1 to phase 4, regulatory filings, biopharmaceuticals, new drug development, advanced PKPD studies, biostatistics, and toxicology studies, which take place at our R&D center. We thank all the healthcare professionals for their partnership and their faith in the organization, in helping us bring where we are standing today. As it is a time to give back, we have contributed in our small ways to the COVID care. Our contribution has been, we have contributed around 51 crores to the PM Care Fund. We, as an organization, everyone has donated 1 day salary towards the COVID relief fund. We have provided around 15 lakh masks, 1 lakh PPE kits, 12 lakh sanitizers, and 12 lakh medical equipments to the medical community to fight against COVID. In a small effort, today we are paying our tribute to the COVID warriors. We have contributed around 8.5 crores towards the police personnel who have laid their life in fighting against COVID. And we have also honored some of our COVID heroes who have come during the pandemic. We absolutely believe that today's doctors are absolute heroes, and we salute our martyrs who have worked day and night during this tough period and helped people survive and make this world a better place to live. So we thank all our doctors, our martyrs, who have really worked hard day and night and made this possible that today we are somewhere getting out of COVID and people who have lived through. So in doing so, I once again welcome you all to our tribute session to COVID martyr doctors from MP Chhattisgarh. Today we have with us Dr. K.K. Agarwal sir. He is a renowned personality, needs no introduction of himself. He is a national award winner. He has Padma Shri to his name, Vishwa Hindi Samman to his name, Dr. B.C. Roy National Award, National Science Communication Award, and many more. He is a record holder of 3 Limca Book records, a gold medalist and Tech Talk speaker, President, Confederation of Medical Association of Asia Oceania, President Heartcare Foundation of India, Group Editor of in Chief IJCP Group, past National President and Honorary Secretary General Indian Medical Association, past President Delhi Medical Association and IMA Delhi branch, former Ethics Committee member of Medical Council of India, and former Chairman Ethics Committee Delhi Medical Council. So thank you, sir, for being with us. Along with him, we have Dr. Satish Joshi. Dr. Satish Joshi, we apologize for the inconvenience. Dr. Satish Joshi is the present President IMA Indore branch, blood bank in charge, a very vital part of today's COVID fight because all the plasma coming in comes from the blood bank. Consultant pathologist at Badani Hospital and Research Center Indore. We have Dr. Sanjay Gonde with us. He is a chest physician, yoga specialist from Indore. He has completed his graduation from MPM Medical College Indore in 1998, practicing for more than 30 years now. In COVID working since 20 days continuously without any leave, even on Sundays also. Working as a task force collector in Indore continuously. IMA body given him the National Award of COVID service. So with his, he has a long list of achievements to his name. We also are honored with the presence of Dr. Sadhana. Dr. Sadhana is the Honorary Secretary IMA Indore. Dr. Natwar Sarad is there with us. And thank you, sir, for being with us. He is Deputy Director, ESI Hospital Indore, Dean, CGP IMA Head of Quarter Delhi. With this, I request Dr. K.K. Agarwal sir to give a small scientific presentation on combination therapy in COVID-19, focusing on ivermectin, doxycycline, and zinc.
Thank you, Manish. And before I speak out, would like the chief guest, Dr. Satish Joshi, to say some introductory remarks. Dr. Satish Joshi.
Good evening, everybody. It's a difficult time of our life. It's COVID time, and we have lost many of our doctors working for humanity, for patients, seeing patients and getting involved, and have many of our doctors have lost their lives all over all the nation. We first pay tribute to them, and we are always with them, and we hope that their families will come out of this shock. And I am grateful to mankind for organizing such a program for the martyr doctors. Thank you very much.
Thank you, Satish. I'd like Sanjay to speak a few words. Dr. Sanjay.
कंपनी का मैनकाइंड कंपनी का जिन्होंने मुझे यहाँ इनवाइट किया, पूरे एमपी छत्तीसगढ़ से मुझे सिलेक्ट किया और मुझे एक मौका दिया डॉक्टर के अग्रवाल के साथ में स्क्रीन शेयर करने का। कितने सारे डॉक्टर थे, जबलपुर के, ग्वालियर के, भोपाल के, इंदौर के, रायपुर के, लेकिन मुझे सिलेक्ट किया, तो मैनकाइंड का बहुत बहुत धन्यवाद। और मैं लगातार 15 मार्च से काम कर रहा हूँ, अभी तक 220 दिन मैंने लगातार काम किया है। तो मैं कोरोना वायरस के लिए केवल 2 लाइन में अपनी बात समाप्त करूंगा कि हारे नहीं जब हौसले तब कम हुए फासले, हारे नहीं जब हौसले तब कम हुए फासले, दूरी कहीं कोई नहीं केवल समर्पण चाहिए, दूरी कहीं कोई नहीं केवल समर्पण चाहिए, कुछ कर गुजरने के लिए मौसम नहीं मन चाहिए। बहुत बहुत धन्यवाद मैनकाइंड कंपनी एंड डॉक्टर के अग्रवाल सर। थैंक यू सर।
Thank you, Dr. Sanjay. And I'll now speak out. And after, once I finish my talk, I would like Dr. Sadhana and Dr. Natwar to make comments on the subject and interact on the subject before we have our formal function of paying tribute to some of our doctors. So thank you very much for asking me to talk on COVID-19 combination therapy. So first of all, I want to pay and dedicate this lecture to all those doctors in the country who have lost their lives, more than 700. If they are listening to me, if their soul is listening to me, congratulations, the 2 vaccines have been approved. And all our doctors in the country within a few months will be vaccinated. So we expect no more sacrifices. Every sacrifice will be remembered. At least we will remember all your sacrifices. Respective IMAs will also remember all your sacrifices. So I say today, with the introduction of 2 vaccines, no more sacrifices. make sure that all of you take vaccine as soon as possible. The vaccine available will be Covishield vaccine from Serum Institute from Oxford. And the Covaxin will be on a standby for selected people where it will be given. But at the moment, both the vaccine have been approved for restricted use in the country. So the first thing is COVID vaccine approved. The second thing is once the vaccine is approved, suppose you take Covishield, first dose has been given. The second dose need to be given between 1 and 3 months. And if you happen to get an infection after the first dose, your disease will be milder. Your disease will be milder. Therefore, after vaccine, even if you get a condition, you get a milder disease. The second fear in the mind of the people is the UK strain. The UK strain. Will UK strain enter India? May have entered. I'm pretty sure that in September, UK cases started increases. In India, they started reducing. But still, we are getting lots of cases of UK strain. How do I diagnose? How do I predict? And how will it make a difference in my practice? Number one, diagnosis is very easy for the UK strain. Each one of you watching this program can diagnose the UK strain. Just look at the RT-PCR report. The S gene, N gene, and ORF1ab gene. ORF1ab will be positive, N gene will be positive, but the S gene will be negative. Because of the deletion of 6970 amino acid, the S gene will be negative. Each one of you can diagnose. Make sure that you ask for all the 3 genes in a RT-PCR test and ask for, could we see the S gene amplification not? If S gene amplification was seen, it is an old strain, and if they say it is positive with no amplification of S gene, you know this is a UK strain. Now, what are these strains? Let us understand by the current strain is 614G strain. That means you have a S protein, you have S1 and S2 part of the S protein. In the S1, you have RBD, receptor binding domain, and receptor binding moiety. Now, whenever you say 614 in S protein, where is 614? From 1 to 1255, there are different amino acids. You say 614 is in S1. In S1, it is outside the receptor binding domain. So this is a balle-balle type of a mutation, which is not that much contagious, and that is the present mutation. 614G mutation present in the blue part, not in the green or the red part. Red means red alert. Green means you enter very easily into the. Now, Nigeria has a 681 mutation, and you say 681 is absolutely at the margin of S1, S2, significant, but alone, therefore ignored. It's a single mutation, ignored. India has 440 mutation. 440 means in the red zone, but because it is a single mutation, it has not caused a havoc. In Kerala, we have 2 mutations, one in the extreme left, one in the extreme right. Nobody bothered about it. But in UK, we have a mutation called 501, which is in this blue part, nearer to the RBM than 614, but it has a deletion of 6970. It also have a Nigeria 681 strain. So it is like multiple parties ने मिलके इकट्ठा एक वायरस बना लिया, multiple political parties ने मिलके consortium बना लिया. That is what UK strain is. There is an Australia strain 477 concern, but alone. And then we have South Africa, 3 strains. All of them are in RBD and RBM. So at this moment, we are concerned about South Africa and we are concerned about the UK strain. If both of them unite together, we may have a havoc. So what? My idea is so what? Even if there is a mutation, it is only going to cause high viral load. Remember, mutation means high viral load. And mutation means, present mutation means S gene is not getting detected in RT-PCR. So detection is easy today and the viral load is high. If the viral load is high, then I need to give antiviral drugs. And couple of days back, we heard ICMR saying misuse of drugs can cause mutations. And that is because I will just come back why they call like that. Now this virus is causing acute manageable thromboinflammatory immunogenic viral contagious disease. So I need a drug which can kill the virus. And if I use a combination of the drugs which acts at multiple levels, so what I need is I need a drug which is antiviral and anti-inflammatory. See here, thromboinflammatory, immunogenic, and viral. If I need a drug, see, thromboinflammatory is the batsman, immunogenic is the bowler, viral is, suppose we say, the tail enders. And if you want a all-rounder, then I need a drug which is an all-rounder but must reduce my viral load. So the treatment today is I want to reduce my viral load. Then why not use remdesivir and favipiravir? Because they take 48 hours to act. They may not act after 5 days because by 7th day the virus is dead. So therefore I need to cover day 1 and day 2. Day 1 and day 2, remdesivir is only indicated if there is hypoxia. So there is no indication of day 1 and day 2. Favipiravir is to be given on day 1 and day 2, but by the time it acts, it is after 3 days. So by that time, virus severity is already gone. So therefore, I am looking, plus misuse of favipiravir and remdesivir cause destruction of non-structural protein 14, which is the proofreading mechanism leading to mutations. So misuse of antiviral drugs can lead to mutations. That's what ICMR said a couple of days back. Misuse of drugs can cause mutation. So therefore, what do I give? I need to give something to reduce the virus load. And if that by reducing the viral load, if I can also reduce inflammation, why not? And for that, I need a combination of the drugs, because combination can act at different levels. I am now going to debate and put my case. There are so many drugs. See, if you see here, there are so many drugs which can cause, they can act as the antiviral at the entry, at the level of ACE2, at the level of transmembrane protease S2, at the level of replication, translation, at the level of proofreading. Multiple drugs are available. I can't choose all of them. So I need to choose some of them to see whether they can fit into my atmosphere or not. There is a drug like famotidine, which can reduce translation. There is a drug like, we have small molecule monoclonal antibodies, we have disulfiram, and number of medicines are there. I am only going to make a case and arguments in favor of ivermectin, easily available, cheap, can be given twice a year normally, along with albendazole, with deworming, doxycycline. Ivermectin is WHO essential list. Doxycycline, out of the two drug, one of the drug which is approved as a broad spectrum is doxycycline, antiviral, anti-malaria, anti-typhus. So we say the drug to be used till culture report or diagnosis is confirmed in fever is doxycycline. And then zinc. Why zinc? Because zinc is absorbed by GI, small intestine, and 40% of the COVID small intestinal absorption is not there. So all of us are in zinc deficiency. So let's see, if we give these three drugs on day 1, does it make sense or not? Does it reduce the virus load? And in addition to it, does it also reduce inflammation in the body? We all know virus phases. The first phase is the virus replication. Second is the inflammatory phase, which is called immune dysregulation. ये virus मेरे शरीर में 7 दिन में अपना काम करके चला जाता है. और मेरे शरीर में आग लगा के चला जाता है, जिसे हम फायर बोलते हैं, जिसे हम साइटोकाइन फायर बोलते हैं. So it burns the cytokine fire and goes back. So I need a drug which acts at incubation, symptomatic, early pulmonary phase and late pulmonary phase. If I can't find a single drug, then I need a combination to cover all four of them, but each one of them should have an antiviral effect. Now, this slide, I will come back again. I have so many choices. I have so many choices when it comes to antiviral and working at every level. Every level, the drug is ivermectin. That means every level, whether it is incubation, symptomatic, early pulmonary phase, late pulmonary phase, the only evidence is in favor of ivermectin. Steroids, only inflammatory phase. Convalescent plasma, only early phase. Interferon, no evidence. Remdesivir, only in the symptomatic phase. Hydroxychloroquine may be harmful. So the only drug which is safe is ivermectin. When you give a treatment of mild COVID, you may give vitamin C, zinc, melatonin, vitamin D3, doxycycline, B complex. You can give famotidine, but ivermectin is a must. Whatever you choose, ivermectin is a must. Let's see, is there an evidence? And this is a hypothesis. Ivermectin is a must. So there has to be some evidence for that. And let's see that evidence. Ivermectin is a potent inhibitor of SARS virus. So it is a potent inhibitor of SARS virus. So it is an antiviral drug. Study from Australia. A single treatment can reduce the virus load by 5,000 times. It's an FDA approved and essential medicine as far as WHO is concerned. And are there studies going on? 1, 2, 3, there are 43 studies are going on ivermectin all over the world. And many of them have been completed. And few of the completed studies are ivermectin associated with lower mortality during treatment of COVID-19 patients, especially in patients who require oxygen or ventilatory support. So in patients, serious patients, ivermectin. 5 days course of ivermectin was found to be safe and effective mild cases. So mild cases, serious cases, now mild cases. And then we come back to Bhubaneswar AIM study. It is 73% reduction if it is given for prevention. And the same study also says 73% reduction if it is taken by healthcare workers for prevention. Then again, this is the same slide I'm repeating, ivermectin at every level. Pre-exposure, benefit. Symptomatic, benefit. Pulmonary inflammatory phase, benefit. And there is another study which talks about a combination of ivermectin, famotidine, and doxycycline may provide robust chemoprophylaxis against COVID-19. So if I have a very close contact of a COVID-19 patient, and if I want to prevent him, I can give him a combination of ivermectin, famotidine, doxycycline, and zinc. Doxycycline, I will come back. Famotidine reduces the replication of the virus. And accordingly, different doses has been suggested. Different doses has been suggested. UP guideline says if it is a healthcare worker, day 1, day 7, and day 30, then monthly. If it is a close contact on day 1 and day 7, if it is treatment, daily for 3 days. IMA guidelines headquarters are weekly ivermectin for doctors prophylaxis. There are different more studies protocols. This is a study by EVMS which talks about ivermectin protocol. There are prophylaxis, other protocols. There is Center for Digestive Disease protocol, but my protocol is very simple. Indian Medical Association recommends for healthcare workers 1 tablet per week. And for treatment, 1 BD for 3 days or 1 OD for 3 days. That's what, and the same protocol needs to be done by healthcare, close contacts to give stat. Whenever you have multiple people in the family, one is positive, give everyone ivermectin stat. Now coming back to doxycycline in COVID, antiviral, anti-inflammatory. See, there ivermectin is anti-inflammatory. Here we are now getting antiviral and anti-inflammatory. It has less antiviral, more anti-inflammatory. There we have more antiviral, so therefore a combination. It also covers for secondary infections. It also covers for atypical bacterial pneumonia, which may be associated. So whenever in doubt, give doxycycline. In dengue and hemorrhagic fever, it prevents cytokine storm. There are enough number of studies. Are there any evidence? Yes, 13 studies have undergone, out of which 5 have been completed. Doxycycline is anti-inflammatory against several RNA virus. It inhibits SARS-CoV-2 papain-like proteases, therefore it's antiviral. It reduces IL-6 and TNF-alpha, therefore reduces mortality. So remember that any drug which reduces IL-6 and TNF-alpha will be useful in the first 48 hours. Third day, we have a pyroptosis pathway which requires a different drug. But in the first 2 days, doxycycline will reduce formation of pneumonia. And we can see here comparative antiviral efficacy of doxycycline and chloroquine. Doxycycline is way ahead. And now we are talking about if you want to give as a prophylaxis, you can give 100 milligram a day. So if there is a close contact, give him ivermectin stat, give him doxycycline, 1 tablet 100 milligram a day for 5 days. And in 5 days, if he hasn't developed any infection, the disease is aborted. But if the patient is having COVID-19, then you give 200 milligram daily for 10 days. In combination, you don't have to give with hydroxychloroquine. There you are giving it not only as an antiviral and anti-inflammatory, but also to prevent secondary infections. Now, these are the studies which are available, which also talks about a standard of care, and they talk about that observational study, which talks about that no death occurred in patients from Bangladesh where doxycycline was given. Coming back to now the third one, which is zinc. Now zinc, again, I need an antiviral and anti-inflammatory essential trace element. Global prevalence is 20%. During COVID era, deficiency is much higher, and it causes metallothioneins, a binding with proteins as metallothioneins. It causes an antiviral load. Now see here, mucociliary clearance in the nose, zinc. Virus replication, zinc. Antiviral immunity by interferon 1 alpha, zinc. Reducing the inflammation, zinc. And in that inflammation, if it is covering the nuclear factor kappa beta pathway, that means first day inflammation and third day inflammation. That means zinc is also going to reduce pyroptosis. That is a third day inflammation. So early inflammation, late inflammation, zinc. Streptococcal pneumonia co-infection, zinc. Then aging, diabetes, obesity, atherosclerosis, immune deficiency, they get intensified if there is a zinc deficiency. So zinc is a must. There are trials going on IV zinc in COVID, and it has found to be very, very effective in hypoxic damage. So if there is a hypoxia, high dose of zinc is very, 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 very important. So there are different types of protocols available. Zinc 50 milligram a day and zinc 100 milligram a day. So what I want to talk about this is, that if as a doctor or my patients, if I give early in the very first day, diagnose in the very first day, and start them a combination of doxycycline, ivermectin, and zinc, I would also add their famotidine myself. And if the treatment is started on day 1, and if I can reduce some degree of virus load, I will also add povidone iodine gargles to that particular patient. So locally, I'm acting with povidone iodine. Systemically, I'm adding these drugs. And if in the first 2 days, I can reduce some degree of viral load, I may be able to reduce a cytokine crisis. I may be able to reduce a progression to pneumonia. I may also be able to reduce the even formation of a pneumonia. Why this to my colleague doctors? Because we end up into high viral load pneumonia. Why? Because cumulative 15 minutes, if I'm working in a COVID ward, even if I'm seeing one patient for half a minute, and if I have seen 30 minutes, half a minute each patient, I may end up into a cumulative 15 minutes exposure. And if I have a multiple virus exposure, I may end up into a high viral load, early pneumonia, early collapse, early inflammation, early thrombosis. So therefore, amongst high viral workers, I need to reduce the virus load as much as possible on day 1 and day 2. These 2 days are very, very, very important for me. And that's the reason I dedicate the first 2 days to all my colleagues who have lost their lives. Because when I have analyzed them, I have found out most of our colleagues have missed the diagnosis in the first couple of days. And the Bombay report very clearly says doctors have high viral load. That's what I wanted to say. Now, both my panelists, I would like Dr. Sadhana and Dr. Natwar Sharda to comment on this before we go to the final function of recognizing our martyrs. Dr. Sharda, and then Dr. Sadhana.
Thank you, sir. We are following you, sir, since early time of the COVID. Sir, you are studying and collecting data, and not only medical field, rather than every Indian is following you since morning, since very start of this COVID, sir. I thank you, sir, and I thank mankind people who has under your kind guidance, they are paying tribute to the COVID warriors. Sir, really all your things, we took role of Ivermectin in first few days, then doxy, then zinc. Sir, we will follow the guidelines you are providing us. It was a very interactive and very good talk from you, sir. Thank you.
Thank you. Let's have Dr. Sadhana.
Thank you, sir. We are very grateful to Dr. K.K. Agrawal, sir, who has always been our inspiration in giving a thoughtful and very recent diagnosis and recent treatment and the practicable treatment also, sir. Because in your views, the treatment part is very much practical, and we have clean and zinc. They are very useful, and which useful in the incubation period also, and in the treatment part also. So, sir, we are very grateful for you, and we are also very grateful for the mankind people who have given so generous and kind approach for our warrior doctors for the COVID. Thank you very much.
I'll now request Manish to go for the ceremony.
Thank you, sir. I now would request Dr. Satish Joshi, sir, to pay tribute to our COVID warriors.
फोन जाना चाहती हो कि फोन कर ले, मेरे एक मोबाइल पे आ रहा है बार-बार फोन.
सतीश सर, आपको अनम्यूट करना पड़ेगा.
Okay. Good evening. I am thankful to Mankind for organizing this program, and also thankful to Dr. KK Agarwal sir for giving us very nice guidance regarding treatment and regarding precautionary measures and so early treatment so that we can save our colleagues of being involved in the COVID. So, sir, we'll follow your guidelines, sir. And I come to the point. We have lost our respected member, Dr. Gajdar from Devas. He was the director of Devas Hospital Research Center. He had 39 years. He was, for last 13 years, he was serving for the population of Devas. He started IMA branch in Devas in 1984, and continuously he was president for 4 years at Devas IMA. He held the post of Vice President, Nursing Home Association, MP State, and he was felicitated by Collector of Devas for serving nicely to the humanity. He started medical facility in Devas, including sonography, CM imaging, and all others. He was famous for his jolly nature, and he was admitted for a long time in Arvindo. He also received plasma therapy over there, but at last we could not save him, and we lost our respected member, Dr. Gajdar. I pay tribute to his work as a doctor to the humanity. Then we have one of our respected member, Dr. Shatrughan Panjwani. We lost him earlier in the month of April, May. He was an eminent physician and child specialist, and I have seen him working for a long time at his clinic and taking rounds to the different hospitals to see the patients. And during COVID also he served to the humanity. He organized a very good zonal conference at Indore. He was head of the Subhash Chandra Bose Academy, and he was a very good human being. We had been meeting him during IMA meetings. He was a very nice and jolly person. We pay tribute to to Dr. Shatrughan Panjwani. Our respected Dr. Ajay Joshi sir, he was the head of surgery department in Index Hospital and Medical College Indore. I had been associated with him for a long time. I met him many times, and he had been serving for last 28 years to the humanity. He was awarded FICS by Association of Surgeons in the year 2015, regional teacher for PG students. He was a very good teacher for PG students, very good man to the patients also. He used to treat poor patients free of cost. That was his quality. He was passionate about his work, and used to sing and teach, and very jolly personality. I pay tribute as we lost him in last few days, in last few months. We lost our member from Chhattisgarh, Dr. Ramesh Chandra Thakur.
Yes, sir. Mrs. Niharika Thakur, sir.
Okay. He was the medical officer at Government Hospital, Nagri, District Dhamtari. He was serving to the patients for last 18 years. He was a masterman and very humble nature in his social personality. We pay tribute, I may pay tribute to him as he worked for patients, but unfortunately we lost him during COVID period. Dr. Bhagwat Prasad Baghel from Chhattisgarh, an eminent physician and the medical officer serving over there for last 30 years. He did not used to charge fees for the rural patients, so he was very nice in serving to the poor patients during his work in normal days and during it work in COVID days also. We pay tribute as we lost him in last COVID period. Our very important personality from IMA, Jabalpur, Dr. Shitij, recently we lost him, Dr. Shitij Bhatnagar. He was medical officer and head of the department at Rani Durgavati Hospital, Jabalpur. And he was serving for humanity for last 20 years and also serving for IMA. He was a very good, very active member of IMA MP, Madhya Pradesh. And he basically was from Jabalpur and a very good, very great human being and a jolly person. I pay tribute as we lost him recently. Dr. Vidyasagar Bajpayee from Chhatarpur, respected sir. He was a medicine specialist, district hospital. He was serving at district hospital Panna. He was ex-chief medical and health officer of Chhatarpur, MP, and worked for these patients for last 36 years. He was awarded excellent work in National Leprosy Eradication Program by Director of Health Services on 6th of November 2006 at Bhopal. He received award for excellent services in district TB officer at RNTCP, State Tuberculosis Committee MP, on 24th March 2011 at Jabalpur. Efforts were acknowledged by State Health Minister for Public Health and Management in the areas of Rajnagar, Laukush Nagar, Gaurihar blocks during July 2005 floods in Ken River, as he was in charge Chief Medical and Health Officer of Chhatarpur. So not only in COVID, but during this different panics also, he served for the humanity. He was famous for his knowledge and intellect in the field of medicine. I on behalf of IMA pay tribute. On behalf of Mankind also I pay tribute, and as we lost him recently. Dr. Natwarlal Heda, he was basically from Itarsi, Madhya Pradesh, an eminent physician and owner of Venkatesh Hospital. Years of free community service provided at places. He had given free service at Itarsi, Gurdwara, Agrawal Bhavan and other locations at Itarsi. He has participated in polio eradication drive for years, working as volunteer at free medical camp for poor. So all the way he was working for the poor patients at different places. Apart from his immaculate and perfect diagnosis, he was an excellent orator and writer with exemplary command over both Hindi and English. He was known for his cheerful smile and positive demeanor, which helped people feel so comfortable with him. So he was very polite and very helpful to all the patients. He was a spiritual man who loved a life of science. He would see patients, even those who could not afford the consultation fees. As for him, being a doctor was more than a profession. He never shied for charity and donation, with including sponsoring food for kids, sponsoring education for poor kids. On behalf of IMA, I pay tribute to our respected Dr. Natwarlal Heda sir. And we can see, as Mother Teresa said, I alone cannot change the world, but I can cast a stone across the waters to create many ripples. As we have lost many of our doctors of all over India, working for to save COVID patients is still working. Our paramedical staff is also working. I am thankful to our doctors, members, paramedical staff, and pay tribute to the doctors who have lost their life during this period. Thank you.
Thank you, sir. Thank you for your warm words. Now I would like to invite, call upon Miss Priya, if she is there. Miss Priya is the daughter of Dr. Natwarlal. Miss Priya, are you there?
Yeah, I'm here, Dr. Manish. Thank you. So, thank you to the organizers and Mankind for, doing this for the COVID Matters family. It kind of helps us bring a closure. And to everyone here on the call who has, been in the situation similar to our family and has lost a doctor in the family, my heartfelt condolences, and I understand your pain. I'd just like to say a few words about my father here. I'm a really lucky girl. I had the greatest father. He was the noblest and the kindest of the men. And he was always there, not just for me because I was his daughter, but for the family, friends, and patients. After his passing, a lot of people tell me that they don't know what to do because he would always pick up their phone in two rings or he would always call back. He was the kind of man who cared for people he was looking after. He was more than just a doctor. He was a healer. Like he had the acumen. He was gifted with the diagnostic powers and the acumen in medicine. But more than that, he had the kindest and the warmest of these smiles with which he greeted his patients, and he reassured them. And he had this balanced language when, even if he had to give them a news which was not really something they look forward to, he would put it gently so that, they could have the mental and emotional strength to take it. And he was a very spiritual man, a man of faith. He did a lot of social work and a life of service, as I mentioned. He worked in a lot of voluntary camps, and this is what I've learned from him: caring and a life of giving and a life of service. And as a member of the bereaved family and his grieving daughter, I want to express my gratitude towards all the doctors who are over here. The fight for a lot of the doctors is lost, but thank you so much for continuing to do the work that you do. And as Dr. Agrawal mentioned, I hope a vaccine is soon available so no one has to go through what the earlier COVID martyrs family have to go through. And again, a gratitude to all of you. Thank you. Thank you so much.
I would like to now call upon Dr. Jay Kumar. He is the cousin brother of Dr. Satrughan Panjwani.
मेरे भाई भी थे, मेरे दोस्त भी थे। मैं उनको IMA में 30 साल पहले लाया था। वो इतने अच्छे इंसान थे। मैं कोई उदाहरण दूंगा। एक पेशेंट उनके पास आया था, उनके पास सिर्फ 200 रुपए थे, उनको 1000 रुपए की टेस्ट लिखी गई थी। तो डॉक्टर से पूछा कि मेरे पैसे कितने लगेंगे? तो डॉक्टर ने बोला कितने हैं आपके पास? 200 थे, हो जाएगा काम। और जब वो लेबोरेटरी में गया तो लेब वाले को डॉक्टर ने फोन कर दिया कि बाबा तो आप इनसे सिर्फ 200 रुपए ही लेना। बहुत अच्छे इंसान थे, बहुत एक्टिव थे। मेरे साथ उसने 30 साल मेरे साथ ही रहे और हमने 1000 से ज्यादा IMA के थ्रू ये कैंप्स भी लगाई। और उनके 3 बेटे हैं, वो उनको चाह रहा था कि उनको पढ़ाई के लिए मैं बाहर भेजूं। उनको बाहर ऑस्ट्रेलिया भी भेजा। सारा खर्चा जो उसने सिर्फ पैसा नहीं कमाया, सिर्फ नाम कमाया, कहीं से भी कर्जा लेके भी उनको ऑस्ट्रेलिया भेजा, लेकिन उनके ख्वाब अधूरे रह गए हैं। अभी उनके बच्चे वहाँ हैं और मैं मैनकाइंड और IMA ने जो उनकी मदद करी है, मैं उनका IMA का और पूरी मैनकाइंड का आभारी हूँ, जो उनको दुखी वक्त में उनकी जो वाइफ है वो नॉट अर्निंग है और उसने जो IMA वालों ने और मैनकाइंड और दूसरी जो हमारे सिंधी समाज के जो पंचायत हैं उसने जो सहकार किया है, मैं इस मंच से सभी का तहे दिल से आभारी हूँ। थैंक यू वेरी मच।
Thank you, sir. Now I would like to call upon Dr. S.S. Bajpai. He is the son of late Dr. Vidyasagar Bajpai.
हेलो सर, मैं हूँ उनकी वाइफ हूँ, डॉक्टर ममता वाजपेयी। वो शायद उपलब्ध नहीं है आपकी स्क्रीन पर, मैं बात करना चाहती हूँ। सर, आज जब मुझे बोलने का कुछ मौका दिया है आपने, तो मैं सोच ही नहीं पा रही हूँ कि कहाँ से अपनी बात शुरू करूँ। यदि मैं अपने पति के रूप में बात करती हूँ या पिता के रूप में बात करूँ कि डॉक्टर के रूप में बात करूँ, उन्होंने हमेशा ही अपने दायित्व को पूरे जीवन बड़ी निष्ठा से, बड़े ईमानदारी से पूरा किया है। यदि पति के रूप में कहूँ तो 36 वर्षों का हमारा साथ था और इस पूरे समय में मैंने उनको एक बहुत ही ईमानदार, ऑनेस्ट व्यक्ति के रूप में महसूस किया। यदि सच कहूँ तो यदि सच में पुनर्जन्म जैसी कोई चीज होती है तो मैं ईश्वर से यही प्रार्थना करती हूँ कि हमेशा जन्म में मुझे उनका साथ मिले। यदि मैं पिता के रूप में बात करती हूँ तो जितना प्रेम उन्होंने बच्चों से किया, पिता का संरक्षण क्या होता है ये आज मैं बच्चों की आंखों में साफ महसूस करती हूँ। यदि मैं डॉक्टर के रूप में कहूँ तो मैं अपने आप को बड़ा गौरवान्वित महसूस करती हूँ, क्योंकि उन्होंने सदा अपने कार्य को पूरी निष्ठा और ईमानदारी से पूरा किया। मुझे याद पड़ता है सबसे पहले जब इंदौर में डॉक्टर पंजवानी की डेथ हुई कोरोना के कारण, तो मैंने उन्हें बार बार सचेत किया कि हम अपना क्लिनिक बंद कर देते हैं। डॉक्टर्स, सारे डॉक्टर्स लगभग छतरपुर नगर के बंद कर चुके थे, तो मैंने भी बार बार सजेस्ट किया कि हम अपना क्लिनिक बंद कर देते हैं, कहीं ऐसा ना हो कि कोविड के कारण ये स्थितियां उत्पन्न हो जाएं। लेकिन उनका कहना था कि नहीं, जो पेशेंट्स हैं वो कितनी दूर से आते हैं, कितना परेशान होते हैं, और यदि उन्हें समय पर इलाज नहीं मिलेगा तो उनकी क्या स्थिति बनेगी। और ये सब देखकर मैं चुप रह जाती और फिर मैंने कुछ भी नहीं कहा। और 87 में उन्होंने रीवा मेडिकल कॉलेज से एमडी किया था, उसके बाद कभी पीछे मुड़कर नहीं देखा। उनके जो एमडी के बारे में, उनके जो ट्रीटमेंट के बारे में, उनके डायग्नोसिस के बारे में पूरा छतरपुर नगर उनका लोहा मानता था। ऐसा कोई पेशेंट नहीं था, दूर दूर इलाज करा के पेशेंट आते दिल्ली और बाहर से, इसके बाद आकर वो यहाँ पर जब ठीक हो जाते तो उनके डेथ के बाद बहुत सारे पेशेंट्स यहाँ पर आए और काफी रोने लगे और याद करते हैं। अभी भी बहुत से पेशेंट्स आते हैं और लौट जाते हैं। बहुत ही धार्मिक प्रवृत्ति के व्यक्ति थे और हमेशा उन्होंने अपने परिवार को, अपने ईश्वर की आराधना को और पेशेंट्स को बहुत महत्व दिया। आज मुझे जो मैनकाइंड फर्म की तरफ से मुझे अपनी बात रखने का, मुझे अपनी भावनाओं को अभिव्यक्त करने का आपने जो ये मंच और अवसर प्रदान किया है, इसके लिए मैं आप सभी का बहुत बहुत आभार व्यक्त करती हूँ। डॉक्टर साहब का जो आप लोगों ने सम्मान किया, इसके लिए मैं आपकी बहुत बहुत तहे दिल से आभारी हूँ। धन्यवाद। थैंक यू सो मच।
Thank you, ma'am. Now I would like to call upon Dr. Anjuman Gajdar. She is the wife of Dr. Wasifur Rahman Gajdar.
Hello, I'm Vamik Gajdar. I'm the son of Dr. Gajdar. I'm here to really thank Mankind Pharma for organizing this tribute to all the martyrs amongst doctors who have perished to the coronavirus pandemic, and it is a really sad. It is a really sad thing that so many of the healthcare workers so many of the doctors and nurses and other healthcare workers have died due to this, and the percentage of them dying compared to the rest of the population is so high, which is not being acknowledged by the common people and the government per se also. So we really have found a good ally in Mankind Pharma and other pharmaceutical companies who have at least come and acknowledge this fact along with the IMA. And I'm really thankful for you guys to remember this. My dad was serving the patients in the small town Devas for 39-40 years post his MS, and he never felt the need to do anything else other than serve the patient. So, and he died doing that. So I don't feel that there could have been any other better way in which he would have liked to pass away. The one problem, the one issue which I feel that we couldn't fulfill is one of his last wishes, which was donating his body because of the coronavirus pandemic. He wanted to be an organ donor, so that is something which we couldn't do. But other than that, I cannot have any other quarrels apart from the fact. Thanks to you all of the guys.
Thank you. With this, we come to the end of the evening. I would request our panel members and our chief guest if they want to have their last words before we go to Dr. K.K. Agarwal. Dr. Satish Joshi, sir.
Hello.
Hello.
Myself, Dr. Shikha Bhatnagar. I need to speak a few words, if possible.
Yes, ma'am, please.
Me being wife of Dr. Shitash Bhatnagar, he is the first one to go in Jabalpur. And describing Shitash, I don't think he was really too short for the personality he had been through. For patients, Shitesh was a person similar or akin to Dr. Agarwal, what his daughter Priya spoke. I salute the mankind's dedication for noticing the supreme sacrifice of my husband as well as all the other Corona martyrs or the warriors during the pandemic who have laid their lives. And I think is the best way for the mankind who is doing justice to its own name and serving the mankind. Thank you.
Thank you, ma'am.
Dr. Joshi,
सर
you want to say
Yes, sir.
something?
सभी लोगों को मैंने सुना। जीवन का बड़ा कठिन समय होता है जब अपने घर परिवार का कोई व्यक्ति हम लूज करते हैं। अच्छा भी लगता है कि कोविड के पेशेंट्स को उन्होंने सर्व दिए, लेकिन जब अपना व्यक्ति चला जाता है तो उसकी भरपाई किसी चीज से नहीं हो सकती है। सभी के मन में दुख है, हमारे भी मन में दुख है, लेकिन भगवान की इच्छा के आगे किसी की इंसान की नहीं चलती है। सभी लोगों ने बहुत सेवा करी और कर रहे हैं। मैं सभी जो भी हमारे डॉक्टर्स ने अपने लाइफ उस कोविड में खोए हैं, उन सभी को एक बार फिर से श्रद्धांजलि अर्पित करता हूं। धन्यवाद।
Thank you so much.
Anybody else who wants to speak? If not,
Hello.
yes, Gaurav.
I would like to speak about a few words about my father, sir.
बोलिए।
So my father was the first person who died of COVID-19. When it happened, it was still in the early days. I live in
गौरव जी, मैं सिर्फ एक ही चीज रिक्वेस्ट करूंगा, आज से जब भी आप बोलेंगे तो वर्ड डाइड मत बोलो, नेगेटिव वर्ड है। या तो बोलो शरीर त्याग दिया, या बोलो उन्होंने सेक्रीफाइस किया। डेथ फादर कहाँ मरे कहाँ है? अभी आंखें बंद करोगे आपके सामने है। उन्होंने तो अपनी सिर्फ फिजिकल बॉडी को सेक्रीफाइस किया है। हिज मेमोरीज आर विद यू, एवरीथिंग इज विद यू। इसलिए पॉजिटिव सोचना चालू करो आज से। जब मेरे फादर ने सेक्रीफाइस किया, ऐसे बोलो, दोबारा से बोलो। वो मरे नहीं है, उन्होंने सेक्रीफाइस किया है।
Yeah, sir, he sacrificed. Sometimes it feels like, why were these medicines not there when my father was struggling in the hospital? Like I remember telling my father not to go to his clinic, and me, along with my younger brother, we all requested my father, please don't go, because I was feeling very uncomfortable with the fact that he's still going to the clinic and seeing patients. But he would say the same thing which other doctors have done and said, that my patients come first. And he was always like Dr. Bajpai was saying about Dr. Mamta ma'am was saying about Dr. Bajpai, that my father was also like very religious man who believed in good karma all the time. He just had this thing that, no, it's a bad karma if I had to do this because that's my karma, and that's defined, like, my purpose in this life is to be a doctor and to treat the patient is the karma that is, defined by God as the purpose of my life, which he served all his life. And then he just passed, like sacrificed his life due to COVID-19. I mean, it's been 9 months, but every night I still miss him and remember him. More than father, he was my friend as well. And whenever the grief strikes at a very different moments, when there's new, like when I remember telling the doctors when they were treating my father that can we try remdesivir on my father, and that time the remdesivir didn't have any double placebo studies done on that. So yeah, I mean, right now I'm very emotional, so probably I'm not getting the right things to say about my father.
Bhagavad Gita chapter 335 श्लोक that says कि जो लोग अपनी ड्यूटी करते हुए जाते हैं, that is what is humanity. जिस कर्तव्य के लिए आपने डॉक्टर बने हो, उसी कर्तव्य को करते हुए अगर आप अपने शरीर को त्यागते हो, उससे अच्छा कोई चीज नहीं है. So it is better to lose and sacrifice our life while doing our duty. ये मौका सिर्फ अभी तक सैनिकों को मिलता था, पहली बार डॉक्टरों को ये मौका मिला है। आप अपनी ड्यूटी पे आपने अपनी लाइफ को सैक्रिफाइस किया, इसलिए हमारा ये मानना है कि दे आर मार्टियर्स लाइक एनी अदर सैनिक, एंड I would say that every branch of IMA Indore branch, Satish ji is here, they should call them as martyrs, and उनका बकायदा इंदौर के अंदर में हर मध्य प्रदेश के हर ब्रांच के अंदर में उनके ऑफिस में इनकी फोटो लगे, मार्टियर्स डे मनाया जाए। जितने भी लोगों ने अपनी लाइफ को रिस्पेक्टिव IMAs में सेक्रीफाइस किया है, उनकी फोटोग्राफ सरकार करे या ना करे, कम से कम हम तो करें IMA के अंदर में। तो मेरी रिक्वेस्ट रहेगी सतीश जी से, आपके ऑफिस में एक बड़ा एरिया बने जहाँ पे मार्टियर्स डे मनाया जाए, जहाँ पे आप लोगों के जिन्होंने अपनी लाइफ सेक्रीफाइस करी है उनकी फोटोज लगे, और उनकी फैमिलीज को जब भी जाना हो वहाँ पर जाएं उनके साथ में। whichever country I have gone, I have seen their medical association. I went to Bangkok, they had their role कि जो कंट्रीब्यूशन सोसाइटी में लोगों ने किया है उनका नाम हमेशा वहाँ जिंदा रहता है। सो आप इसकी शुरुआत कर सकते हैं इंदौर से, और उसके बाद में जो अब तो आपके यहाँ पे हेडक्वार्टर्स में भी काफी सारे लोग हैं, and you can move it to others, but at least charity begins at Indore, start at Indore.
Sir, we'll do it, sir. We'll do it.
I think Dr. Dilip wanted to say a few words. Dr. Dilip, are you there?
Dr. Acharya.
I'm there. Good evening, everybody. I must say these are very emotional moments to hear martyrs, family members talk about things. I have been closely associated with all three martyrs from Indore. Dr. Gajdar was my classmate. Dr. Ajay Joshi was a surgeon, and Dr. Panjwani was a good friend also. So my heartfelt condolences and tribute to them. And I must say here again, I've been following Dr. Agarwal for many, many days nowadays, right from the start of COVID. And sir, your lectures every day is very informative and very assertive to the patients also. Even sometimes my patient, I tell them, go and join Dr. Agarwal's lecture, and you will be able to learn much more than what we are going to tell you also. So once again, thanks to everybody, and thanks to Mankind also for keeping this webinar. Thank you, sir.
So if not, I only want to say is that each one of you are precious to us. जिन्होंने सेक्रीफाइस किया उन्हें हम याद रखेंगे, बाकी लोगों को सेक्रीफाइस करने की जरूरत नहीं है। अब हमें मालूम है कि Day 1 to Day 3 are very, very, very important. Day 1 में बीमारी को पकड़ो, वायरस लोड कम करो Day 1 and Day 2 में। Day 3 में इन्फ्लेमेशन को पकड़ो और इन्फ्लेमेशन को खत्म करो। Day 5 तक इन्फ्लेमेशन खत्म करो किसी भी हालत में। Day 7 तक आपके लिम्फोसाइट्स बढ़ने चालू हो जाने चाहिए, ताकि आप Day 9 में बाहर निकल सको वायरस को मार के। Day 11 तक आपके एक्सरे के अंदर में CT स्कैन आगे प्रोग्रेस नहीं होना चाहिए, क्योंकि आपने इन्फ्लेमेशन को खत्म कर लिया। So remember, Day 3 is the important. Kill the virus before Day 3 and kill the inflammation by Day 5. That should be your objective. That Day 3 से पहले मैंने antivirals, whatever combination you can give, attack from every side, साम दाम दंड भेद, जो भी देना है आपने। Day 1, Day 2 के अंदर में पोविडॉन आयोडीन, फेमोटिडिन, जो देना है दो। Day 1, Day 2 को अटैक करो। Day 3 के अंदर में इन्फ्लेमेशन को रोको अगर आ गया है। Whatever you want to give, steroid, aspirin, whatever, colchicine you want to give, mefenamic acid, whatever you want to give, start attacking the inflammation on Day 3, ताकि Day 5 तक अस्पताल जाने की जरूरत ही ना पड़े। That's what I dedicate my learning from. All my learning of prevention has come from all our martyrs. I've been talking to them, talking to the families. मैं रोज कोशिश करता हूँ, किसी के घर में डेथ हुई है, किसी ने सेक्रीफाइस किया है लाइफ, तो मैं उनकी हिस्ट्री को पढ़ने की कोशिश करता हूँ। कहाँ पे गलती हुई, कहाँ पे सीख मिली, गलती तो नहीं बोलूंगा, कहाँ हमें सीख मिली। और मेरी सीख में यही आता है डे 3 एंड डे 5 कि 3 से पहले वायरस को कम करो, 5 से पहले इन्फ्लेमेशन को रोक दो, ताकि हम लोग डे 7 में हमारा लिम्फोसाइट काउंट बढ़ना चालू हो जाए और डे 9 में हम एंजॉय कर सकें इनसे। वायरस बल्ले बल्ले, थैंक यू वायरस फॉर enjoying 9 days in my body. Now you have no place in my body. Over to Manish.
Dr. Manish, you are on mute.
Yes, आप म्यूट में हैं आप।
Manish ji,
आपको अनम्यूट करना होगा। Yes.
Yeah. Yes. I thank all our panel member and guests for joining us on this evening, and I thank all the members who have joined us. And as Mankind Pharma, we have been doing our best possible effort, whatever efforts that we can do in paying tributes to these martyrs. And in future as well, we will stand with the medical fraternity in best possible ways. Thank you once again, and have a wonderful evening.
Thanks, Mankind, for your noble initiative. Thanks a lot.
Thank you, Manishi. Thank you, Mankind. Thank you, our respected Dr. K.K. Agarwal sir, Dilip sir, Natwar sir, and all members and all families who joined us.